So today I'm reacting to how AI is diagnosing patients in 2025. So some of it's incredible and some of it's terrifying. And yes, I'll tell you if AI is actually better than us. I'm Dr. TJ Ahn. Let's dive right in. And I'll show you the 4 cases that blew my mind. First, we are watching a clip from MIT's Jamil Clinic about Sybil. This AI model sifts through your lung CT scan and predicts your risk of developing lung cancer up to 6 years before symptoms appear. Isn't it crazy? It's powered by a deep learning trained on thousands of low-dose CT images.
And using it to say, well, 3 years from now, is this patient going to have cancer? Sybil, we think, is a tool that can help illuminate for doctors who are those people who are at risk.
Sybil can look at a CT scan of a patient and tell us the likelihood of this patient developing disease in 1, 2, and even up to 6 years.
Instead of taking into account clinical factors like age and tobacco exposure, Sybil analyzes all of the information available in a patient's CT scan. By drawing on knowledge from thousands of other CT scans that were used to train the model, Sybil can classify the image as a high-risk person or a non-high-risk person. Then, the doctor is able to make a clinical decision.
The power of Sybil really lies in integrating all that information and not just the information that we as radiologists have sort of defined as relevant over time.
So this is an example where Sybil really was able to tell the future in a way. This is the same guy, 2 years apart. Mm-hmm. And here, the radiologist didn't see a lung cancer.
As a radiologist, I wouldn't have pointed to this at all.
But Sybil was able to say, something about this scan makes me worried, especially this little area.
In that location, correct.
And then the same guy, 2 years later, there's actually a lung cancer in that area.
Yeah.
So how did you like it, guys? This is really cool. It's like having a crystal ball for your lungs. So Sybil analyzes layers of scan data to surface risk factors we'd likely never seen on your own. Now, next up, we have a CyberSight video. It shows AI helping detect diabetic eye disease, which is a diabetic retinopathy. So even in places without nearby eye doctors. With just a small camera and internet, this AI makes sense of retinal images to flag vision-threatening issues.
CyberSight AI, built and operated in-house by Orbis, uses artificial intelligence to analyze images of the back of the eye and detect signs of common eye diseases like diabetic retinopathy and glaucoma. It can be operated by a nurse, technician, or even a community health worker, and takes just seconds. Orbis is rolling out this approach in low and middle income countries around the world, like here in Vietnam. The result? More patients are getting care, and local ophthalmologists are freed up to focus on seeing those who need immediate treatment. A clinical trial showed patients screened with CyberSight AI were 30% more likely to pursue recommended specialist visits than those who had to wait for results. Early diagnosis and treatment through screening can reduce the risk of vision loss by 98%. We know what is needed. We have the technology in place. All we need are the resources to scale our approach globally.
Alright, this is medical access in action. AI bringing vision-saving tools into everyone's hands, no matter where they live. So leave me a comment below what's your thoughts about AI diagnosing alongside the doctors. Now let's take a look at this NBC News clip from Cleveland Clinic. Doctors here use AI as a second set of eyes, especially for challenging MRI reads like epilepsy scans from brain MRI scans. So real patients, real nuance, AI backing up human care.
It's a second set of eyes with your doctor, operating as kind of a second opinion.
To give you an idea,
We visited Dr. Irene Wong in her research lab to see it in action.
there are more than 400 MRI slices.
She's the research director of the Epilepsy Center at the Cleveland Clinic, where AI is already making a difference. Dr. Wong can team up with an AI system that has learned from a network of past epilepsy cases. The AI can then zoom in on an MRI scan to highlight a probability map for doctors to investigate further.
The more yellow or whitish, the harder it is. It pinpoints you to the area of the brain that calls for your attention. And that is the lesion that causes seizures.
If the AI, the machine learning, is wrong, who's then liable? Is that on the doctor?
I think that's an area that is yet to be decided. It shows you that, the technology, the pace of improvement is much faster than the speed that our policies have moved. There is potential for harm.
So that's added precision with empathy from doctors. Human compassion paired with AI accuracy, I strongly believe that is exactly what we want when it's you on the table. Finally, here's a CBS News segment on Microsoft's diagnosing AI. It claims it can diagnose 4 times better in accuracy compared to doctors in some tests. Wait, what? We see demos and hearing from clinicians who reminded us, so this is a cool video, this is powerful, but I don't know, it might be too early to claim like that. Let's watch a clip from the source a bit.
A step toward medical superintelligence. That's what the CEO of Microsoft is calling the company's new artificial intelligence tool. So Microsoft says it can diagnose patients 4 times more accurately than doctors and at a fraction of the cost. So with people increasingly turning to the internet to diagnose their health troubles, Microsoft says AI could be transformational. So I want to bring in Will Knight, a senior writer for Wired, to talk about this new AI tool. Thanks for joining us. Let's get right to it. Tell us about it.
Sure. Yeah. So this is a exciting step in this long-standing vision to use AI to help with medical diagnosis. Plenty of work has shown that language models, such as those used in ChatGPT, can potentially diagnose people's illness. But this is the most realistic simulation of the way doctors do it. They had the model do things like devise what tests a patient should be given and go back into the back and forth that is involved with diagnosing something. So it's still early stages, but this shows the potential of AI. And obviously there are a lot of pitfalls, there are a lot of issues to consider. But one of the most important things also is that this shows that there is potential for AI to reduce the cost, which is obviously such a huge issue in healthcare.
Yeah, let's talk about that. We know that healthcare is extremely expensive. So how could this tool really lower the costs?
So in their experiment, at least, they had the model or the series of models optimize for cost. So try and figure out how to get the right treatment, get the right diagnosis, but factor cost into that and reduce the costs. And so that, because the system is in some ways, they call it superintelligent or a step towards superintelligence, but it can factor in a lot more data than a doctor. So potentially it could help reduce some of those costs that get incurred with treating patients. I should caution that there are other factors that this needs to be tested in a clinical trial, really, because there are things that the AI doesn't consider. Like your doctor may know what instruments are available or what kind of tests a patient would be willing to have, and may factor that into their consideration. So it's early days, but there is the potential there to reduce those costs.
So those claims are bold and attention grabbing, but I don't know. This might be a little bit of hype right now, don't you think? But hype alone doesn't heal. We need really thorough validation before we go trusting it with real lives. If you like this zero fluff, reality first take on healthcare AI, hit that subscribe button now. Stick around because next I'll show you where you can find the most useful AI tools to know in 2025. Again, no technical expertise required. So here's what we saw today. Sybil gives us proactive way to monitor lung health. Cybersight brings accessible eye screening to everyone. Now the Cleveland Clinic YouTube clip shows us how AI can support, never replace, the real clinical reasonings, right? And Microsoft gives us a glimpse of where diagnosis could go under careful supervision. So remember, AI isn't magic. It's powerful pattern recognition with the machine learning that helps us, but it doesn't understand empathy, context, or experience. So here's a better question for all of us. patients, family, and everyday folks, right? Will AI replace your doctor? My answer and my hope is no. But can it help them spot things earlier and improve care? Absolutely. That's the promise we should embrace. If you want to watch interesting perspective of AI, go ahead and subscribe to my channel. And check out the one that pops up next here, my top picks for AI tools to watch in 2025. Here's the simple truth. AI sharpens your tools, but healing, trust, and human connection, that's still shaped by human doctors. Together, that's how healthcare becomes better for everyone. See you in the next video.